Good morning, good afternoon, good evening, all IMGs. Welcome to USMLE Sarthi portal. Today we will discuss that how tele-rotations are different or how tele-rotations are similar with the on-site rotations. Many of you might think that tele-rotations are not valuable as on-site rotations, right? But in this case, USMLE Sarthi's tele-rotations provide EMR access. Yes, you heard it right. EMR access in the tele-rotations. So let's dive and see how it works.
Dr. Saad's tele or hands-on internal medicine or family medicine orientation. This is going to be a video about how to navigate the EHR and practice fusion, as well as on how to complete a note during the rotation. Primarily, I want to focus on right now on these two tabs that you'll be using frequently, schedule and charts. You'll be using charts in the event that you can't find the patient that's coming into the room in the schedule. At times we may have lots of patients and it may be difficult to go through the list. So you could always just go to charts here on the left-hand side. Go into making sure that patient list is selected on the top here, and then go in and type in the patient's name. In this case, for HIPAA compliance, we're going to just be using a fictitious name, in this case being a practice patient. So once you've typed in the practice patient, or in this case the patient itself, you'll be able to hit the search and you'll be able to see a list of patients. If, for example, it is a very common last name, then use the differentials of date of birth and gender to distinguish between the correct patient. In the event you were given the date of birth, ask someone in the group to actually see if you can find the date of birth. If you're a telemed, if you're hands-on, the face sheet will have it. Just navigate there and find it. So in this case, we can go right into the patient note. This is our practice patient for today. Now it'll open into timeline when you search for it. Timeline isn't very useful. It'll just show you and populate the last encounters for this patient. More importantly, the summary tab will be useful for you as it represents a snapshot of the patient and their history. So you'll see, for example, flow sheet, and flow sheet will contain all of the vital and pertinent information in vitals, including blood pressure, height, weight, pulse, respiratory rate, and O2 sat. For our purposes of this rotation, we'll focus primarily in obtaining the blood pressure, pulse, and respiratory rate for follow-up visits and for established patients. But if it's a new patient, make sure to obtain the height and weight along with blood pressure, pulse, and respiratory rate. Moving on, if it's an established patient, they'll have diagnoses. In this case, if it's a new patient, there won't be any. And if you have to add any, if they come to you and they say they're diabetic, you'll hit the plus here, and you'll be able to just put in diabetes, insipidus, idiopathic. So in this case, let's just say it's type 2. And you can ask them if this is a chronic diagnosis of over 3 months, and see if they may ask you if you can tell them, well, when was the diagnosis made. If they can remember at least the date, that would be nice. If not, just put in chronic if you know it's been a while. If they just recently got diagnosed, then put in acute. And then make sure to make the save at the end there at the bottom. And then you'll see that it's been added to the diagnoses. For new patients, you can put that if it's confirmed. If they're unsure, then just put a note on your notepad and you'll work with the provider to correcting those diagnoses. If they're established, I would disregard inputting or correcting anything unless the provider explicitly indicates for you to change those diagnoses. For social history, this will be important if they're a new patient and being able to record this. For established patients, I wouldn't touch this. I wouldn't add anything more unless it was pertinent. Unless the patient is coming in that's established and letting you know that they started smoking, started using alcohol, or started using drugs of some sort, that might be the most common reason for us changing the social history. But if it's a new patient, by all means, please do make these changes and adding the information. So you'll be, again, adding if they're a smoker, non-smoker, what kind of tobacco, Same thing with alcohol use. You'll select as well under alcohol and do these similar case questions. For those other miscellaneous social history, for example, you can put in marital status if it's pertinent, as well as if they have any opioid use in their history. If there's a new patient, please do so. Put when they started using opioids and what was their drug of choice. And if they've had any history of other opioids in the past, and make sure to press save when you're completed. I would not look into doing anything about education or stress. These I would just leave blank. In terms of sexual history and gender identity, sexual orientation, leave those explicitly for the events where an established patient is coming in for a particular reason, whether it's an STI or immunocompromised disease like HIV, where it's relevant. I wouldn't, put the odd situation of you guys being interns asking sensitive questions to patients right off the bat. If there is the case where you feel uncomfortable asking those questions as well, just wait till the provider is there. But again, the general rule is if it's pertinent to the HPI where you need to follow up, just ask the patient if they'd be comfortable with answering some sensitive questions because it's relevant to the case as they're coming here complaining of potential sexual transmitted diseases or infections, and then you need to explore further. Moving on, allergies, same idea. If it's a new patient, please elaborate in filling this in, ask them what kind of drugs they're allergic to, food or environment, and then also explain the severity and reaction being, anaphylactic, or is it some type of rash that's going on, and when was the onset? And mostly they'll say unknown, but if that's the case, then just select it, and then just press save. Medications for established patients. There will be a list here of medications. I would just use this as a referral only if they're established and following up. If they're a new patient, by all means, start putting in the meds that you can put in. If, again, hit the plus, be able to just type in and search for certain medications. You can find the most frequently ones here on the left-hand side. You can also type them in. If it's, for example, oxycodone, see if you can get the milligram dose. If you can't, just write it down on a piece of paper before the provider comes in and then just list them. And then you and the provider will decide on what dose is appropriate. Not everyone will remember their doses, so just keep that in mind. Medications are useful as well for you to kind of get a snapshot of what the patient is on, and maybe there's possibility of some contraindications that might be leading to the symptoms that they're exacerbating at that time for their visit. So it's a nice snapshot before they come in to the encounter. Once you receive the name from the medical assistant, have a few moments to just go through the snapshot, get an idea of what is going on with the patient. And then if you do have time, you can go to a previous note. In this case, for example, we can go to one before, let's just say we can just go into this one here in July. And obviously now this would be filled, and you would be able to then just see the completed note over here. And when you know something else you would notice is the tabs here that would open up on other notes. So in this case, you would see today's note being September 5th, or previous note being July 14th. And you can switch between tabs to see if there's any pertinent information that you would want to add to your current note. So that's one way to find previous encounters. In this case, we were doing lots of orientation, so that's why there's several notes here. And after that, once you've had that snapshot of everything you need to know about the patient before they come in, you could start the new encounter. And this is how you start your note. You're going to hit the orange button where it says new encounter. Just say create new encounter. If it shows continue with in progress encounter, that means there might be a note already open. If this note is already open, then I would select that. If I'm creating a new encounter and I know that the other note was wrong, then by all means hit the create new encounter. This will only show up if there's already been a progress note for that day. If there is no dialogue showing that, it'll go right into the new encounter. and it will look like this. So when you see chief complaint, for example, how I want you guys to look at completing the note is you start off with the chief complaint, work through the flow sheet, move on to subjective, which will be your HPI, and then into your objective where you'll go and complete your 12 system setup for review of systems. Finally, you'll complete the plan with the provider in the room. The assessment is to be left for the provider only, and any of the other miscellaneous billing information, diagnoses, leave that all for the provider to complete. Medications also will be refilled and signed by the provider. You should also leave those alone. To complete the chief complaint, either obtain the information from the medical assistant when they come in the room, ask them what the purpose of the visit. They may tell you it's a medication refill visit, lab review. It could be also for just a cough, chest pain, either to look up, follow up on their diabetes, whatever the reason may be. Just indicate in the point what the chief complaint is. If you're unable to get it from the medical assistant, then obtain it directly from the patient and ask them what the purpose of their visit is today. What brings you into the clinic today? First, introduce yourself to the patient. Indicate you're an internal medicine or family medicine intern. In this case, just simply stating you're an intern for Dr. Saad and letting them know that Dr. Saad will be seeing them shortly, or a provider will be seeing them shortly, and they allow you to ask a series of questions before he comes in. If they say yes, then you can continue on with the encounter. In this case, it's important for you, from once you've obtained the chief complaint, to go into the vitals. As stated before, just a regular follow-up. Try to obtain the blood pressure, pulse, and respiratory rate. Whether you're a telemed or a hands-on intern, work together in trying to get that. If you're telemed, ask in the group to get someone to get you those vitals. If you're hands-on, work with the telemed internist to work in obtaining those values. If it's a new patient, please do try to get the height and weight of the patient along with the blood pressure, pulse, and respiratory rate of the patient. Temperature obviously is pertinent if they're coming in here with some kind of ailment. That temperature is relevant to rule out any fever. Moving on, you'll see the medications list. Medications will be relevant in the event that you have extra time between the time you finish your encounter and ready to present to Dr. Saad or one of the providers in the group and still waiting for them to come into the room. Then by all means, you can review the medication list with the patient in the meantime while you're waiting and see if they're taking the meds as directed. In order to find the direction of the medication, you can either click on the medication itself and you'll have the SIG information here. In this case, it's pretty basic, but in most cases you will see the direction indicating if it's a BID, if it's a PROS medication, is a QHS, stuff like that will be in there once you hit the actual med. If there is some changes in medication, just write on a note and have the physician change the direction of the medication or remove it from the medication list. Please do not do it without authorization from the provider. One of the most important things and components of us assessing you during this rotation is the subjective and the objective part of your note. So again, with SOAPs, subjective, we're looking for a history, present illness related from the experience of the patient. I like to break down just a generic template as colder as, condition, onset, location, duration, exacerbating, alleviating, relieving, and associated signs and symptoms. Breaking down your HPI in that acronym helps you create a nice substantial note. You create a timeline, and you're able to relay and convey that to the provider that you have covered all your bases for whatever reason they're coming in for. Now, obviously, if this is medication refill, then try to ask questions as like how they're doing on the medication, have they had any nausea, vomiting, any associated signs or potential side effects of the medication, and ask any other relevant questions that might be related to their past medical history by referring again back to their summary note. Also, it's important to use templates, especially when starting out with us. If you feel a little bit lost, we do have several templates. In this case, for example, they're coming in with GERD-like chief complaints. You can select GERD on the left-hand panel, select it, and it'll give you a few pointed questions. Now, obviously, I want you to fill this in with the patient's demographics. So indicate in this case, patient is a 21-year-old male or female patient coming in due to epigastric pain, and then, establish or elaborate on exactly what the pain is. Is it burning sensation, epigastric pain? Is there any nausea, vomiting? Going beyond that to just create a timeline and seeing if anything has been done to abate any of those symptoms as well. Definitely use the templates for subjective and objective when using our encounters for opioid use dependence for patients that are addiction patients, Suboxone or Vivitrol. You are going to use the OUD templates. Now, there are two templates here. There's one for new patients. That's going to be a more elaborate questionnaire for you to ask this new patient so we can actually understand when they started using their opioids, how they were using them in terms of intravenously, nasal, transdermal use. Really important so that we can follow up on whether or not they should go and see an infectious disease doctor. Especially with sharing needles, there's always a higher risk for hepatitis C and other infectious diseases. Also want to follow up to see if they've benefited from any individual or group therapy, any detox program, any rehab programs, any 12-step programs, or MAT, medication-assisted treatment programs like ours, like Suboxone, and for how many months and how many treatments have those worked. Methadone is also an alternate MAT program as well. Making sure to complete anything with an asterisk or forward slash is important for you to edit and answer. If there is no response, then just eliminate it completely from the note. Also, another thing to remember, in all our notes, we would like to see that there is a denial of any negative symptoms, as this helps the clinic from any liability of potentially a patient coming out of the clinic and falling. And there may be a revision of the note, and we want to make sure that we have all our bases covered. And this is important for all of you moving forward in your medical practices to know that you are ruling out and you've actually gone through to make sure that you've asked the patient if they've had any chest pain, any shortness of breath, any abdominal pain, or any complaints other than those, as well as syncopal events. In this case, it being an addiction patient, UDS being urine drug screen, and MAPS. MAPS is Michigan's assessment for risk in terms of them diverting medication, or so-called doctor shopping, where a patient is going clinic to clinic looking for certain drugs so they can either divert them or sell them to other clients so they can make a profit. And that's one way for us to assess risk to see if whether or not this patient is being honest and taking medication as prescribed. So once you've been able to verify a UDS has been done, how we do that, the face sheet will have that. So if you're a tele intern, you would ask the hands-on intern to relay the information on what drugs were shown in the urine drug screen. So if this is an established patient, for example, then if you hit the view templates, you'll be able, like I said before, there would be two templates. There would be new patient and the other one. And so the second template for OUD is the one for a follow-up visit for Suboxone. So when you select that, you'll see that previous UDS will show here with +4 and -4. In this case, you're going to ask the person in the room or the MA, for example, if you are in the room alone, whether they were positive for Suboxone and metabolites. That is what we're expecting for a recurring visit for someone that's on Suboxone. We're expecting them to have the buprenorphine in their system and also their metabolites. Norbuprenorphine should also be expected to be seen in their urine. Things that we don't want to be seeing unless they have a prescription or following a psychiatrist or a other physician that's prescribing them benzos or prescribing them amphetamines or barbiturates, then that would have to we'd have to confirm that those things were prescribed. If they are positive, then mention that they were positive for benzos, barbiturates, and amphetamines in that prior urine drug screen. If not, then you will put in negative for any illicit substances or drugs. Objective, you're going to be using the template for your review of systems. So you'll just put in ROS, and from there you'll select, and it'll populate the review systems for you. You can also produce the vitals here as well. Just copy the vitals that you've obtained from the top and put them on top here as well. Go through the 12 systems with the patient. If you're able to have a hands-on person with you, have them work with you in obtaining all of the information you need from your review systems if you're a tele intern. Once you've completed that, make sure if you're a tele intern and no one else is in the room, then message the WhatsApp group so that you can let the providers know that the patient is ready for you to present. So if you're a tele intern, make sure to obtain the room number as soon as you log in and start your shift with the senior intern. Ask what room you're in. If you're hands-on, then once you've worked with the tele intern, getting all this information and finishing the objective component, you'll report to the doctor's lobby room and have the doctor come back with you and present in the room in front of the patient with the tele intern as well. From there, you will move on with the assessment. There will be a differential diagnosis discussion as well as plan of care. Allow the provider to complete the assessment, and then you'll move on with plan of care. In this case, if it's not related to opioid use dependence or alcohol dependence, then just transcribe what the provider is relaying to you. In this case, for example, if it was GERD and there was going to, for example, we were going to start some triple therapy with the patient, or we're going to do an H. pylori test, convey that in the note, make sure that they'll follow up for results next week. Or say, for example, that we've already had done that before. In this case, we're going to refer them out for an endoscopy. Then you want to also relay that in the plan of care. Say it's something different where we're sending them out for imaging. Same idea, relay exactly the plan of care that the provider is indicating in the room. Anything you are unsure of, just ask the provider if they can reassure you of what they exactly meant. And in case of any dosages as well, it's good standard practice to repeat back the dosage that the physician has indicated to you. If they've weaned it down, if they're doing a formulary change, or for example, it's no longer working and we're discontinuing, make sure you can reiterate that with the physician. All the lab orders and medications will also show up here. If in the event that the physician has done it or provider has done it and it doesn't show up, you can go to the top here and see the refresh page. You just hit the refresh button and it'll populate the meds at the bottom here. And you can just copy and paste the entire name of and dosage of the medication and paste it into your plan as well. Everything else is no longer required. The physician will complete the rest of it. Don't forget to put your initials at the end of the note in the plan so that we can give you some feedback on your notes. That way everyone can be getting credit for all of their work and hopefully be able to grow with the experience. This concludes the orientation for the EHR. I hope this was helpful. I hope you enjoy our experience. Goodbye.
Mostly tele-rotations are conducted on Zoom. You will engage in the video calls, review patient data, take interview notes, document their medical history, and subsequently participate in the discussions about the case with your preceptor or team. It is just similar to on-site rotation. You will be assigned to patients about 10 to 12 in a day to interact with them, manage their care, update the EMR, and present cases to the team. Exposure to the EMR will help you in your residency and adapt to the software easily in the future. Similarly, the exposure to the EMR will help you in your residency journey to understand the medical culture. LORs are given after completion of your rotation. LORs are completely performance based. Sarthi is committed to help all IMGs to get the strong and personalized LORs.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.